Are you Miss Rogers?
Hi, I'm Molly. Nice to meet you,
Nice
Molly.
to meet you too. Would you like to be called Miss Rogers or
You
Jamie?
just call me Jamie.
Okay. And what are your pronouns?
She, her, hers.
Okay. So obviously my name's Molly McAfee. I'm a student at Indiana Wesleyan University, and I'm in the master's program for mental health counseling. I know we spoke a little bit on the phone, but I wanted to go over this informed consent with you real quick, and that's your copy. So basically the way it breaks down is there's an evaluation. That'll probably be in the first couple sessions that we have together. And then by the end of that, we'll discuss if you think that I'm the right fit for you for what you need. And if not, I can ask my supervisors to refer you to another therapist. And then second page. So there's a lot of benefits and risks from therapy. Therapy requires a significant investment of time, money, and energy. It can be extremely effective to help address emotional and behavioral difficulties. Potential benefits of therapy include improved mood, reduced stress, better coping skills, and enhanced relationships. The next thing I want to talk about is confidentiality. So, informed consent is basically you saying that you understand the confidential laws that I'm going to talk to you about real quick. So everything that we talk about is confidential in our therapy sessions, unless you give me written permission to tell somebody else. But the exceptions are I'm required by law to report what we talk about here if I suspect abuse or neglect. For example, regarding children, elders, disabled adults. And I'd also be required to disclose information if a court wrote a subpoena and ordered me to. If you are at harm to yourself or others, I would also need to report that to the authorities immediately. And then with your permission, I can consult with other professionals about your case. So I'm a student, so my supervisors, my professors are going to be looking at the videos, just making sure that I'm giving you the best care so they can give me feedback in case I'm not catching something because I'm still learning. And then if you use your insurance benefits, I must share clinical information about you as described in the insurance reimbursement section. So fees for a mandatory to standard fee, it's $100 a session, and the sessions are 55 minutes. The last 5 minutes of the session I'd like to spend on scheduling you for the next one, hopefully if it works out. Do you understand everything so far?
I think so.
Okay. Are you be using insurance or private pay?
I'd hope to use my insurance if you're in network and accept it.
Okay. And we can get that all set up afterwards to make sure if it's in network or not. So just a little bit about your rights in therapy, because I want you to be informed since have you ever been to therapy before?
A couple times, quite a while ago.
Quite a while ago? Okay. Was it a good experience?
I think so.
Okay. So you have the right to participate actively in your treatment and make informed decisions about your care. I think you are the expert of your life. I believe that I can maybe just help you navigate through it and better since you're here because you're having some difficult situations. You have the right to ask any questions and request clarification. So if I'm saying something that you don't understand, please stop me. I have a tendency to ramble. You also have the right to terminate therapy at any time. So if you think that I'm not the right fit or life gets busy, just let me know. And we can, again, I can recommend you to someone else if it's me, or if therapy is just not the right time in your life right now, that's okay too. You have the right to seek a second opinion. Again, if the advice that I'm giving or guidance that I'm giving isn't helping you reach your goals, then hopefully just talk to me about it and we can reevaluate. Contacting me through the office. I have a work phone, which you've already talked to, or email is easiest. If you need to cancel, I just ask for 24 hours in advance. I know there's emergencies, but just let me know. So if something comes up, that way way I can get you rescheduled as fast as I can. Do you understand everything about the informed consent and the confidentiality? Yes. Okay. Then we can sign. And now we can get started. 13th? It's the 14th?
Oh, it is the 13th. So
If you're like me, I don't know what day of the week it is at any time anyways. Okay. So now that that is out of the way. So okay if I take some notes?
Mhm.
Okay. So why are you here today?
A few times recently, and it's happened in the past. I don't think it's any more frequent than usual, but I've had some dreams that I wake up and I'm kind of screaming or like I would say like moaning, but like just kind of wakes me up and I'm not really sure why it happens. I don't always remember the dream or what was going on, but is there something that's happening during my daytime that's causing this response, this reaction at night? It can just be kind of frightening at times.
Has anything been going on recently? Is this an all the time thing?
No, I mean, it happened, I think, once last week and maybe a month ago. And then it's been months, I mean, quite a long time. But I mean, it definitely has happened in my past.
Okay. Has anything stressful been going on at the same time?
I mean, I've had some changes at work, but I'm not really, I know I'm not dreaming about work.
Okay, well, I guess my question is, how important is work to you in your whole circle of life? Like if it was a pie, what chunk piece would it be?
Gosh, I mean, I spend a lot of time there, and it's so I guess not necessarily a time component, but I mean, probably 30-40%.
Okay. What do you do again for a living?
I'm sorry, physical therapist.
Okay. So you work in healthcare.
Mm-hmm.
Do you enjoy your job?
For the most part.
Okay.
Has its ups and downs.
Okay. And there's some stress going on now at work?
Yeah, I've had a change of location, so there's some new coworkers and different policies than the ones that I was used to for quite a long time. So just changes.
Okay. Do you take change well in general?
I think it's just it's stressful. Like I know that change can be good.
Mm-hmm.
Sometimes it's hard to see the positives in it, so it is hard to do that. I think if I have more control over it, or it's my choice, that's great. But haven't really had any control over this one.
Okay. Any other changes in life in general lately?
Like a positive one.
Okay.
I mean, been dating somebody new. Things are going very well.
Okay. What kind of goals do you want to work on through therapy here? I know it sounds like maybe some anxiety, obviously some dream situations.
Yeah, I guess trying to figure out if there is some kind of daytime causation for the nighttime things, or if it's just a really random occurrence. I don't know. I'm sure there's things I could work on during my workday that would help me with some of the stressful situations there.
Mm-hmm.
So maybe I don't know if it's one and the same or two different things.
Is it people at work, or is it just the lack of control at work?
Yeah, I would say both.
Okay.
Yeah.
When you say people at work, is it the people that you work with, or is it your patients, or?
I mean, patients are always, well, I shouldn't say always, but I know what to expect. There's highs and lows and everything in between. Not a ton of surprises there, but with your coworkers, I feel like it should be relatively easy, and it has been that way. And there's just a couple new people that have very negative attitudes and not very welcoming to myself and some others that moved there with me at the same time.
Okay. So, if I'm hearing correctly, there's some new people at work, some change at work, so change that you didn't control. Your location got moved, which is stressful, and then at the same time, you get moved to a location that you didn't pick, and there's some rude people, that now you not only do you have a new location, but you have these difficult people to work with.
Yeah.
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 So when they have a negative attitude, what does that make you feel like?
I mean, I think it just makes my day even harder. I mean, there's, again, the stress of patients and having to manage just time management there. And then with them chiming in about everything being negative and horrible, and it just, it's just very wearing. It's exhausting.
Mm-hmm.
I find myself escaping at lunchtime just to get away from them, honestly.
Is it a tight area that you guys work in?
It is.
Okay.
Yeah.
Do you have, like, just unfamiliar with it? Do you guys have offices? Do you have cubicles? Is it just a large room with desks, or?
Yeah, so it's kind of an L-shaped office, which is where people tend to look at cell phones, eat, everything except treat patients.
So that's like your own little area.
Should
like
be a sanctuary. That's how I look at it, or have in the past, and it
Okay.
doesn't feel that way anymore.
Okay. Have you talked to them at all?
Yeah, no, they're not the easiest to talk to. I don't feel like they've been interested in what I have to say. It's just kind of their topics and their opinions, and either agree or we just don't talk.
Okay. Do they make your work, what you're physically doing with patients, do they make that difficult for you? Or is it more just kind of what you feel on the inside, just frustration?
Well, we recently kind of reorganized our treatment area twice now. And, I think they had their space prior to me coming in there. I had my space, and trying to incorporate everything. There's been some pushback from them, and I'm just trying to make things flow better. So I guess in that aspect, they're wanting to move things to make it less accessible, just less optimal, in my opinion.
Mm-hmm.
That does hinder the patient care.
Before so you said you moved things twice.
Mm-hmm.
Before you moved it the first time, did you run it by them? Of like, hey, is it okay to move stuff around? I'm new here.
Yeah. Like we had a planned move date where some new, different equipment would be brought in. I thought we had a plan, had a vision, and kind of set things in place as best I could. They weren't there that day, and so move things. And then when they came back, they wanted a complete change. And I don't dislike the complete change. It's a lot of physical work, and then there's just a few things that they did want to move that again makes it harder for me or harder for some other folks.
Mm-hmm. Do you have a supervisor that you could talk to, like kind of meeting in common ground, or?
I mean, when it comes to like that reorganizing, the boss just says, "You guys figure it out, you do it." She's not going to be a mediator or step in at all.
Would you want her to be a mediator?
Oh wow, I don't know that she'd ever do that.
But would you want her to?
I think it'd be nice where if we could have that open conversation of, "Hey, we did this, thought we had a kind of a plan, and then you came along and said something else." I think it'd be a safer conversation with her there than just the therapist.
Mm-hmm. Is that something that you might want to try?
I think we can. I don't, we don't get a lot of time to do things like that.
Mm-hmm.
It's just all about patient care, and yeah.
Could you guys make time for like a meeting, like a group meeting, or?
I don't know if we have monthly meetings anymore. There's really not a lot of time. We have different lunch hours, and so there might be some overlap where we could for a few minutes.
Mm-hmm. Do you think it's to the point where you need it, or is it not kind of hit that escalation point yet?
I don't know what they're feeling. I mean, I'm okay with this, kind of second move of things. I kind of stated my case for one particular item, and I think we came to a compromise. I don't know how they feel, but
Okay.
so I don't think we're angry at each other and becoming completely dysfunctional.
Okay, so you can still kind of work, at least not together, but intermingled.
Sure.
Yeah. Because you guys don't work on people at the same time, right? It's just you're individual people, someone else.
Yeah, I mean,
you're all-
they don't rely on me for their patient care and vice versa. Yeah, I'm just in my own little world. Yeah, we share space, but we don't. I don't want to say we don't help each other out. That it sounds bad, but that's just not how it works in our PT world.
On the level of like 1 to 10, how stressful is work to you? 10 being the most, like you don't even want to go to work anymore, you want to quit. And 0 being like, oh, I love my job so much, I could live here.
Yeah, I mean, it's probably anywhere from 6 to 8, given the day, the time.
Is it usually that way in the past?
Oh, there's definitely times where it's been very, very high.
But since the, like before the move,
I mean, things were probably pretty smooth at that point.
okay.
Like 2, 3, coasting along.
Okay. Do you do anything to help you with your stress?
I try to exercise. If the weather's finally nice, I can get outside and work in the yard or maybe go for a bike ride, and that's definitely helpful. Call my sister from time to time, and we kind of just let each other go and get out a few things.
Okay. In your culture, how big of an influence is your family on you?
Don't have a lot of family at this point, so I would say in the past it was huge. Always had like a go-to person, and they're no longer around, and so it's, I think everybody, we're just, my sister and I in particular, kind of floating on our own little islands, and we interact more than we have in the past, but I don't think it's a lot compared to maybe some other families.
Okay. Do you rely on yourself to make decisions for yourself, or do you have to run it by other people?
No.
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 Are you a religious person?
No.
No. Okay. Are there any other goals that you want to work on other than kind of working with work stress?
I think that's a big one right now. Yeah, that's it.
Do you have a strong support system? I know you said that you don't have a lot of family, but friends?
I have good, very good friends.
Yeah.
Yeah.
Are they aware of kind of how stressful work is right now?
I think to an extent. Yeah, sometimes when I'm with friends, I just want to have fun and focus on the good things and not just have a bunch of negative time with them.
Yeah. So your nightmares, do you want to talk those a little bit?
Yeah, I remember one from last week. It was really weird. It's like I was in my childhood home and my dad was there, which he died 21 years ago. So, but it was like current because he had COVID. And I remember being really upset that I didn't know he had COVID till I walked in the door completely like unmasked and whatnot. And so I remember calling my Nana, who also is no longer alive. And I can remember I could hear her voice, like her real voice. I was just calling to see if I could go stay with her and be safe. And she was like, absolutely. And then I don't know why I woke up kind of yelling out. There wasn't anything. I wasn't yelling at my dad. I wasn't yelling at anybody. I know some of the other dreams or times I feel like I've either been like smothered or something physically, like I was being harmed, but don't remember any of the other circumstances with it. It's like I wake up very startled, and usually I can just roll over and go back to sleep, but
Okay. Has there been any recent, I know you said that your dad and your Nana had passed away, any, maybe like their birthdays have been around the nightmares or death days around the nightmares?
I mean, Nana's birthday is next Saturday, the 19th. The day my dad died is actually May 1st, but I don't know.
Have you ever talked about these kind of things with anybody else? With your sister?
Like the dream stuff. I mentioned the dream with Dad and Nana to her yesterday. But she had also brought up the dream that she had had, so I wasn't that necessarily initiated that conversation, just kind of chimed in. I don't usually, because other than like waking up yelling or screaming, I don't think there's much else to say. Don't know that I would just tell anybody, hey, I wake up screaming in the middle of the night.
Have you ever been in the past diagnosed with post-traumatic stress disorder or anything? Any kind of diagnosis?
No.
No? How do you feel when you wake up from the dreams?
Like my heart's usually racing. I say it's just like a startle, almost like just some fear. But then when I wake up, I realize like it was just a dream. It's nothing real. And that's what I can usually just go back to sleep.
I guess have you ever kept a dream journal?
Mm-mm.
Do you think that would be something that you might want to try? Just a notebook by the bed? Because I know, we don't really control if we remember them or not, because I have dreams like that too. But maybe trying to write down details as soon as you wake up. Could. Yeah, if you wanted to.
Yeah.
Okay. A little homework for you.
Yeah.
What else can you do at work to not be as frustrated? I know you said that you get away for lunch, so you kind of get to leave the area. Okay.
There's some other people there that I am very close and have positive relationships. So I go talk to some of the others, not necessarily about the negative people, but just on anything else. Just have a nice conversation.
Do you have to be in the same small area with them, or is there a way for you to get your own like room or office or a cubicle? I don't know.
Yeah, I guess now I can actually have my own little space. It would be very out of the norm. I don't know if anybody would even notice, or well, if I notice, I don't know if they would care. But then I'd be really, really isolated from some of the people that I do want to talk to.
So you think it's more important to you to be by the people that you do want to be by than kind of maybe tune out the ones that are negative and that you don't have anything to do with?
Yeah.
Okay. Are your other coworkers aware of the frustration or aware of the difficult people or?
Oh, they share it. Somebody that had only been working there 1 or 2 days a week recently came back full time, and without any like prompting or any discussion of it, she brought up how those people are just so negative and again kind of closed off and don't want to interact. So it was like, oh, definitely not the only one that notices and shares the same thoughts.
When you say negative, what do you mean? I know you said closed off, but like,
yeah,
are they actively being like rude, or are they just
we have certain like productivity standards, and it's very hard to achieve and almost set up that we mathematically cannot. And they just continue to harp on it. They've recently had to change their treatment times, so they're having to do more treatments, and they feel stressed and poor. Like they just want to kind of fight every change that has happened. They just don't want to work hard, and they want to find any way to make their lives easier. I get about making things easier, but not doing your fair share. That's another thing.
So they kind of taken out some of their frustration with the change and you guys coming in, like out on you guys.
I don't think it's necessarily us coming in. It's just there were other changes that happened at the same time, coincidentally, and yeah, they don't like it either. And some of the other changes that were for them, like I had already been doing, other people at my clinic, we were already doing that. The shorter treatment times and seeing a lot of patients throughout the day. So that aspect wasn't stressful for us. So they've had an added stress, and they're not adapting well.
Is there anything that makes them happy at work?
No, no, I don't know. I can't.
Can't.
Yeah.
Haven't seen it.
No.
Okay. Do you guys do any like kind of team bonding or like bringing in like sweet treats, or does that make them?
It's like, sometimes there's just randomly people bring in donuts or cookies or other things. They partake in it. Yeah. I think, excuse me, we're supposed to do some type of group event again just during the lunch time quarterly, but
Has anyone tried to plan that yet?
oh, I've run with a few ideas and I'm supposed to be one planning them. I'm not the best party planner. So eventually I'm just gonna just dictate that, hey, we're gonna do this, and if you want to participate, fantastic. If you don't like it, oh well, I really gotta get this done.
Okay.
It's not forced fun, but it kind of sort of is.
Mhm.
We'd like to have something that everybody could enjoy, but it's kind of limited with the constraints that we have.
Okay. Well, we are coming to the end of our session, so I'd like to go over real quick just a little homework, because from what you told me, I'm kind of hearing that you're a little worried about these dreams, the nightmares, um, and that you're having stress at work. So, just kind of stepping back to the dreams. I think it's the homework that I'd like to, if you want to do it, is that little dream journal. Or also, if you have thoughts during the day about the dreams, write those down too, just to see if it kind of makes sense of things a little bit more. And then also, try to write down a little bit of like, did you go to bed stressed? Were you worried about something? Were you anxious about something like right before? It could be anything, but like right before bed. And then see if we can kind of see if those things like correlate. And then with the work, why don't you try to plan that event? And maybe would you be okay with reaching out to the grumpy gals and asking them, what do you enjoy beforehand?
Yeah. I mean, I would like to do something that
they enjoy.
Everybody,
yeah,
could enjoy at least a little bit.
Okay, I think that's good homework for the first time. How does your week look next week?
Probably a little more available towards the end of the week.
Okay. How about Thursday?
That works.
Okay.
Or something a little bit later in the day.
Later in the day. How about 6:30 p.m.?
That'd be perfect.
Okay. So 6:30 p.m. next week. And homework is dream journal and planning project. Okay. Does that sound good?
Yes.
Okay. Do you think we can work well together?
So far.
Okay. Well, thank you so much for coming in. If you have any questions, you have my work email. You have my work cell phone. If you need to reschedule, again, just please try to do it before 24 hours. But if an emergency happens, that's life. So just let me know.
Okay.
Okay.
Great. Thank you.
Thank you.